Very good morning to all of you. This is Dr. Rajat, and I would like to welcome Sakshi Khanna. She's a blogger and goes by the name Wise or Otherwise, and she's planning to write a blog on various aspects of facial aesthetics. In terms of both doctors practicing it and their side, and also in terms of patients or regular people who have a slight understanding or a very basic understanding and they want to know more about it. So we'll be talking in this session in terms of perspective of doctors and patients. It will cover almost all these aspects. So I welcome Sakshi and I thank her for giving me an opportunity to speak.
Thank you so much for having me, Dr. Rajat. It's actually a pleasure being here. And there's a confession I have to make, because when I've been researching and I follow your posts and all. But the first thing that caught my attention was not even the matter. It was the pictures that I saw. The results that you post, the before and after. And when I just wanted to just see through as to what exactly it is, it is something really amazing, something which I actually took time to believe that yes, something like this can happen. So, and all these non-surgical procedures which you do, so can you please elaborate how you go about doing this and this magic that you're creating?
So Sakshi, I started practicing injectables in the facial area about 9 years back, and since that time there has been a big change in how things are now.
Yes.
A lot of new things are coming in, and a lot of new techniques are there. So non-surgical facial aesthetics, or as I may say, injectables, are in a big way replacing conventional surgeries, facelifting surgeries and all.
So is it like you saying that you are giving a very good substitute for plastic surgery?
Yes.
Is it something like that?
Yes, I would like to say that because, if you undergo a knife procedure, so it requires some sort of hospitalization. It has a certain amount of downtime.
True.
And you are under anesthesia, you get the procedure done, and you have what you have.
Yes.
While with injectables, we can take this step by step.
Okay.
We can take this, the patient, it's a lunch hour procedure. So the patient is very comfortable, and they have a choice. They can choose as much as they want, and they can even build it up later on.
Choice as in what? What kind of choice?
Choice as in how much effect they want, how much sort of result they want, how much product they want. So, and how much time we give to the body, because now we are using a lot of regenerating fillers and other stuff. So we have time, we do the procedure, we have time for sort of regeneration, and then we can top up the result. And everything is in control in your hands. You're up. It's a lunch hour procedure, and there is no need to sort of, there is no break.
No break.
From work, and
yes,
you can do your regular stuff.
Just regular, your daily routine,
yes,
carry on with that.
Exactly.
Okay, I wanted to ask you, Dr. Rajat, that this is different people, they have different textures, of the skin, and some are sensitive, some are not. So, the same procedure and the same protocol is followed for everybody?
Yes and no. Okay, there are certain techniques which are sort of basic techniques, and you do it for everyone. And the Sakshi here, my experience of doing trainings and working in different parts of the world has helped me a lot. I have worked with different ethnic backgrounds, people with different facial features, with sort of different types of skin, types of and not only this, different sort of psychology and mindset towards these people.
I guess that is one of the most important factors these days.
Yes. So I've seen that what probably people in Europe think or accept as certain treatments is different from what it is in India or maybe South Asia, and we have different sort of, these people have different facial features, different sort of aging skin, so all these things taken into consideration. Every single individual is a different person. If
Very
you take
true.
as a case,
Yes.
and with experience, you sort of tailor make their treatment.
This is like you're customizing beauty for them.
Yes, of course, there are many things which go into it. We need to have a consult with the patient. I have to understand what is their mindset, what they're looking for, what I can do for them. So, and then it's a big question about, how much they are willing to sort of spend. So, all these
That's a
things
big factor.
taken together, and how much receptive my patient is also. Are they understanding what I'm trying to say? Are they understanding how the treatment will take shape, how the results will sort of come?
So when you say receptive, I mean, you're talking about the patient being receptive towards the procedure that has to follow, or receptive towards what is happening at that particular time.
See, what happens with injectables is that in some cases we have different sort of age group people.
Yes.
Young people, some sort of middle age, some old people. So with different sort of and you see, once we age, we are losing not just collagen.
True.
We are losing bone structure. We are losing fat.
Yes.
We are losing collagen. And with gravity and certain muscles in the face, they are pulling the face down. So for every person, you cannot say that a 35-year-old got this much filler done or these many sessions done, and a 60-year-old woman also expects the same.
Yes.
You understand? So the initial treatment plan and
Varies,
explanation
with
to
the
the
body
patient, yes, that please don't compare yourself with someone else. You're a different person, you're a different face altogether, you're very unique. You're unique, everyone's unique, yes.
Okay, Dr. Rajat, like when you talk about your procedures, you say that we inject this, we inject that. Now, a person like me, who has so much of phobia when it comes to like taking an injection also. So, are these procedures like very painful? I mean, and especially people like me who can barely get a vaccination done,
Yes.
So, can we also think about something like this?
So, this is a very, very good question because, everybody sort of asks this question about, how much pain will I experience. So, there are many different ways to sort of take care of that. Okay, we have anesthesia, we can give anesthesia, people who are trained to give anesthesia, and I want to emphasize this point because a lot of my dentist colleagues, they are starting to do these procedures and they are doing also these procedures. So dentists are sort of very well trained with giving anesthesia in the head and neck region. They have like a full-fledged sort of subject in local anesthesia. So this is very important. Giving anesthesia, having good knowledge about how the anesthesia works, how to sort of make it painless, and then we have new things coming up, of course. And since almost last year, I have got this piece of wonderful equipment.
This looks like a flashlight to me though.
Yeah, it looks like a pen, and then we have cartridges for this.
Oh, lovely.
So this is a needleless. As you can see, there is no needle attached to this.
Can I just have a
Yes,
look at
yes,
the?
yes.
No, I would like to hold the
We'll show the
pen, please.
Yes, yes. This is the
So
pen.
how does it actually work?
So this pen has a piston.
Okay.
You sort of take this cartridge, you fill it up with anesthetic or with filler also. So now we are doing also fillers which are without needle. There is no
That's
sort
lovely.
of, and you attach it here,
Okay.
and you can use this device to give anesthesia. You can use this device to give put fillers inside absolutely without anything. So normally when we give anesthesia also with needle, the patient feels a certain level of discomfort.
Yes.
Okay. With this pen, you will not feel that. So I can now say when I have this pen that I am doing a completely painless procedure.
That's wonderful.
Number two, when I'm also injecting, apart from this, this is working very well for fine to medium sort of wrinkles and lines.
Okay.
When I have to do structuring, facial profiling, when I have to enhance certain features, I am working and I'm teaching also a lot of my students to work with Canva. A cannula is something which is, which is black.
Something which they pierce here or
Yeah, it's slight. Yeah, it is for a layman, yes, but it is slightly sort of different. And this cannula will never cause any injury inside because it will slide in smoothly. It will never pierce. A needle will pierce wherever I push it, but the cannula, if you put it in the right plane, it will slide in very nicely and easily, and it causes minimal discomfort. So there are a lot of ways, a lot of techniques where you can make these procedures totally painless. Yes. Yes.
And Dr. Rajat, when a person goes through these procedures, are there any side effects that the person has to bear later on?
Yes, a few side effects are there, and slowly with advancement in newer techniques and using new sort of ways to do injections, they are becoming very less. And I urge also many injectors to sort of keep themselves updated in training and doing procedures in such a way that these side effects are kept to the minimum. So the basic side effects like bruising, for example, if I use a cannula, there are chances that the bruising will not happen at all because it is not piercing, as I told you, and then slight discomfort, slight swelling can be there. But if you are a properly trained doctor following right techniques, the scope of side effects has become very less.
Really?
Yes.
And also, like once you do the procedure, is it something like a permanent thing that the person can get done, or if not, then what is the duration?
There are some things which are temporary, there are some things which are semi-permanent, and there are some things which are regenerative. So when I say temporary, I would like to include Botox in that, neurotoxin or neuromodulators. So whenever we inject Botox, we relax the fine lines and wrinkles. Okay. We also, in dentistry, we use it for many therapeutic indications. For example, people who have teeth grinding habit, they have strong masseter muscle. Whenever we have to sort of change the bite of a person, give crowns and implants and so we inject Botox and relax these muscles so that the force on these new restorations is less, and slowly it fades away. In people having sort of when people smile and their gums are showing, this is called as gummy smile. So we use it there as well. We also use it for headaches, for myofascial pains. So there are a lot of indications where we use this, and the life of Botox actually varies between 4 to 6 months. So it is very helpful now because I also do lip repositioning procedures. Before, if we were not using Botox here, these procedures would give a decent result but would relapse. But after I give Botox, during the healing time, my muscles are relaxed. Healing happens in a very good way without any stress, and I'm able to give a very good result without relapse. So Botox is one category which is temporary, so you have to sort of repeat it, even for aesthetic and even for therapeutic purpose. Then we have this hyaluronic acid.
What is this?
Hyaluronic acid is actually, our bodies have hyaluronic acid in most of the tissues, in skin, in eyes, in bone, and hyaluronic acid is responsible for hydration. So this filler is something which is widely being practiced. This is the most common filler which is being sort of globally practiced, and this is the first filler I started with, hyaluronic acid. And this filler, when it goes inside, it attracts a lot of water, so it gives a smooth, shiny effect, and sort of it acts also like an implant, which stays there for some time.
So is it something which helps your skin to glow?
Glow, and you can also give enhancement to certain features. So this filler stays anywhere between 6 months to 1.5 years.
Oh, that long.
Yeah, and this slowly goes away. Now we come to regenerating fillers. So there is a category of fillers which is unlike hyaluronic acid. They are stronger. They are more powerful in the way they give the effect, and they are also regenerative. So, for example, we have polylactic acid. This is one filler which comes in this kind of a powder. Okay. So we have to.
Can I have a look
Yes,
at
yes, sure. This is polylactic acid.
Okay. This looks like powder to me.
Yes, this is powder. So we have to mix normal saline or liquid, sterile liquid, bacterial static water to it, saturate it, and then we inject it after 3 days.
Okay.
So this filler is much more powerful and stronger in the way that it will go in first. These small particles, powder particles, will disperse, and they will act as a center for new collagen formation.
Okay. So because this is strong, so
Yes.
this has a long-lasting effect.
Yes,
in comparison
this
to
stays for anywhere between 2 to 3 years, the particles. But what happens is, now I will not say that it has a life of 2 years or 3 years, because it has helped me to make new collagen. So new collagen is for me to keep.
Okay.
Okay, so that will age with the normal sort of aging. So this is a regenerating filler. This is also called a semi-permanent filler.
Okay.
Then we have this filler, hydroxyapatite. Okay, this filler is very well sort of known to dentists. Many people don't know,
Okay.
use it as fillers, but hydroxyapatite is something which is sort of which is the core of dentistry. Why? Because our teeth are hydroxyapatite. The bone where we drill implants, where we put implants, the maxillary bone, the mandibular bone, the jaws,
Yes.
that is hydroxyapatite.
Okay.
Okay, and a lot of dentists who are doing implants, they are also doing bone grafting.
Okay.
We do grafting. We take grafts and we put it in the sort of body to make new bone. So hydroxyapatite is something which is which lies in the core of dentistry. And as dentists, are not just teeth doctors.
Yes.
Dentists are working on teeth, on soft tissue around the teeth, and also the jaw bones and related structure. So hydroxyapatite is a very good replacement for lost tissue, for lost bone, for example, for lost, for the lost collagen, lost fat. And this filler, it is pre-mixed, these small particles of hydroxyapatite, and they have a carrier gel, carboxymethyl cellulose. So this gel acts as a carrier. When you put this filler, you immediately get an enhanced effect, very good result. And these particles then, they start attracting collagen, and they make new collagen. So this is a great addition to my practice now. I'm doing it quite a lot.
Okay.
And then we have certain fillers which are, for example, Profilo. It is a bio-remodeling filler. You can call it a filler or not. It's a very different thing.
Okay.
So it is given in certain areas with a certain technique, and this filler helps to make 4 different types of collagen.
Okay.
And if I have to explain it to the patients, it is like an internal moisturizer.
Oh.
So it goes inside it. It is the only filler which has 32 milligram per ml hyaluronic acid, but it is different that you need to do a couple of sessions probably sometimes, and this will not give a lifting effect, but it will improve the texture of your skin big time.
Okay.
It will make you feel more moisturized inside.
And
Also in
softer.
loose skin and the neck, we are using this. Even for small scars.
So does this help in sagging also? I mean.
It helps in loose skin to help in making new elastin fibers, collagen fibers. And so what happens is that these are the different fillers. Then we have threads, different types of threads. For example, we have mono threads. We have cork threads with cannula. These are lifting threads. We have bundle threads. So with one cannula, you can put 10 threads together in one area. You have polylactic threads as well. Okay. So these different threads, and then you have very special thread which is called as micro cannula thread. Micro cannula thread is used for lips because it's with a cannula again, not with a needle.
It's
This small.
injected in the lips.
Yes, and also in fine lines, under eye, for example, which is a place where you can have a lot of bruising.
And this again is painless.
This is totally painless. Okay, this is whatever I'm talking about is totally painless. Now we have achieved that level that we can make our patients totally comfortable. And this micro cannula is a great boon because in this area, under fine lines, fine wrinkles, I can use this and it helps in making information again. Okay, and then I would like to speak also about PRP, plasma rich or vampire lift, as some people call it. But I have never taken that modality as a single primary modality for facelift or anything. No. It is secondary to other modalities. So it is always number two to give it sort of regenerating effect. It is very slow and it is never my primary. So if I use threads, I can use PRP. So all these injectables, now we have a lot of injectables, and we then talk to our patients and discuss with them, and I tell them what I feel is good for them. As I told you that different sort of patients have different needs, and so these different fillers we can use and get the best out of combining these things. For example, now I know hyaluronic acid is a filler which is a hydrating filler, right?
Yes.
So I would never use it in all cases.
Right.
In cases which have a lot of sagging, I will waste this to bring this, fill this gap, to bring the cheek up, for example. If I have to bring the cheek up, if it's so much sagging, I would waste it just to sort of fill that big space between bone loss and loose skin. I would use it smartly with some other filler or with some thread, and I would exactly use it for what it's best known.
So that you are in a way making the best use of the product
Different products,
and giving the best result.
Yes. This is very important. I cannot just have a filler here, hyaluronic acid or some Botox, and fix all sort of different people and different sort of categories of problems people have. I have to have knowledge of all these things so that I can combine. See, what is important for us is, number one, we have to give the best treatment to the patient, right? Number one. Number two is we have to give it with least possible use of
The product.
Okay, I have to be that smart in planning my treatment, that I combine different modalities, use less of each modality, and give that kind of rock solid result. So this is important that we have an understanding of all these products. We know how to use them, and we know how to use them without even letting the minor side effects come in.
Yes,
This is
I
the
think
most
that is a very important aspect.
Yes.
Okay. Okay, Dr. Rajat, there's just one thing that crossed my mind while talking to you. That there's a myth. People say that all these things that you are talking about related to the skin, the dermatologists are the ones who are certified to deal with this. So, and what about the dentist?
This is a very, very interesting question, and it's been debated quite a lot. So, from my global experience, from
I know
different
you've been
countries.
doing
Yes.
workshops in India as well as abroad.
Yes. See, a dermatologist, for example, would be a doctor who takes care of skin disease. Yes, skin disease, and would train himself or herself to do these procedures, right? So these procedures are not a part of any curriculum. Okay. So any doctor, dentist, or nurses, where they allow nurses to do these procedures, would have to undertake a proper training to develop a skill. Now, it puts what I'm saying is that all medical doctors, and nurses in countries where they allow nurses are at a good position to do this, because we are not, first of all, treating a skin disease. This is not a skin disease. Number one, we are not only just losing skin, we are losing bone structure. Okay, we are losing fat. We are losing, and then it's not just that a one specialty can do a certain thing. For example, if I'm a dentist, a dentist is in a sort of position where they are already there. Why? Because they are doing injectables in the head and neck area. Since they are training from their third year, they are practicing to give local anesthesia to the patient in these areas. So they are anesthetists for this area. We are working on the bone. Likewise, we are doing implants. We are doing surgery in the jawbone. So someone who's doing surgery, giving anesthesia, who's working in sterile conditions, who knows the complications of local anesthesia, for example, and other medical emergencies in dental practice, is in a much better position to learn these things. And having said that, I'm not saying that no other specialty is I'm talking about my perspective.
So basically, you are saying that the dentists are also well equipped to do something like this because of their profession, something they're already doing.
It is the nature of their profession. It is very important to understand a dentist is not a doctor of tooth. If that dentist was a doctor of tooth, then they would inject anesthesia also inside the tooth. They would not work in the bone. Bone belongs to orthopedician, as all of us know, but we are working in the bone. There is a specialty in dentistry which is called as orthodontics and dentofacial orthopedics, okay, which takes care of sort of aligning the teeth. And so a dentist works with teeth, with soft tissue around the teeth and jaw bones, which is very much a part of our career. And then we enhance this skill to sort of give injectables in this area.
Right.
We are not working in sort of other parts. We have a basic understanding of head and neck anatomy. Head and neck anatomy is taught to us for more number of weeks in our curriculum than even a medical graduate. We are doing more injections with patients during our training as to be a dentist than any other specialty. So
this is basically a myth.
Sakshi, it is very important to understand that I cannot say this belongs to me totally.
True.
Any doctor who's an injector, and every doctor is an injector, nurses are injectors, you have to learn a certain skill the right way. The most important thing is that you have that skill to do that job.
Very true.
Doesn't mean that I'm a dentist and I just straight away sort of start doing these things. I have to understand the biomaterial, that is the material we spoke about.
Right.
I have to know the anatomy. I have to understand how to give anesthesia. All these things are involved. So it boils down to being skilled in doing this. This is what I would say about this. Yes.
So this is basically not about being a dentist or a dermatologist. This is how well you go about.
What is your skill level?
And the experience.
How much skill do you have? See, for example, we have a lot of patients, dental patients, who have muscle problems. For example, this is masseter muscle. It gets sort of involved when we have temporomandibular joint problems, when we have sort of myofascial pain, when we have tummy smile, So, why would that patient go to a skin doctor for a muscle problem which is related to, teeth and related structures or jawbone, So, yes, of course, dermatologists have been conventionally doing these procedures and, you have a skill and you do it. You are a doctor, you are a dentist, you are a nurse, you have a skill. How good a skill you have, that what defines how good an injector you are. Yes. How good results you get.
And that
with
is
less
what is the most important thing.
Yes.
So now, Dr. coming to your workshops and trainings, because I've seen that you're traveling most of the time, and even within India and out of India, you keep conducting these workshops and trainings. So could you please tell us, what exactly goes into all that, and if people want to approach or be a part of it, so how do they go about it?
So I'm conducting a lot of trainings in India, primarily in Amritsar, where my clinic is, then Bombay, Delhi. A lot of trainings in Europe, different countries, in Sweden, Norway, Czech Republic. These places are done. Germany, different sort of multiple times. Also in Russia, in ex-Soviet countries, in South Asia. So and I have sort of, because different countries have sort of different regulations. So I have different sort of students or colleagues, from different specialities who are learning and inculcating this in practice. Yes. So it requires hard work and it requires a very ethical training, and you make sure that you do hands-on training. You teach people how to do this job the best.
How does the person make the right decision as to which one to choose.
Okay, Sakshi, I'll just put a question to your question.
Yes.
When you come across these brochures and sort of, do you also come across cases being shown by these people? What kind of work they do? You know, to showcase their, you know, sort of work done by their students, or, you know.
Is it like something like the before and
Before
after
after
pictures or
pictures, yes,
something
yes.
like that? You
Yes.
know, now that you've put up this question and I just introspect, it is just the matter that I come across.
Yes.
Very rarely, you know, do I see that any picture is posted that the person has done some kind
Yes.
of work or something.
So this is what I like to say. You know, I'm somebody who likes to keep quality at its top best.
Okay.
This is my sort of, you know, the base at which I teach. I like to train somebody totally hands-on, and not just one time, multiple times, till the time I'm satisfied or they're satisfied that they can do the job by themselves.
Very
It is very important. See, everybody wants to get their treatment done from an experienced person, right? From an experienced, and
Yes.
even if I have to get some treatment done,
Yes.
I would go to an experienced doctor.
Very
right?
true.
But nobody is born experienced, right?
That's right.
Nobody is born experienced. So that is why you go to learn from experienced people.
Okay.
Because, you know, they've been there, they've done that, they're updated. They would tell you what is not there in textbooks.
Exactly.
They will tell you from their experience what to do and what not to do and how to do it. There are so many techniques which I do are not, you know, sort of published or not in some books. It's my sort of experience over, you know, a certain number of
Yes.
years. The way I used to work, for example, in 2010 or 12 or 15, was completely different than how I approach to things now.
And I'm sure it is
Yes.
far better than
Yes,
what it
of
was.
course it is sort of, you know, step by step. So experience is one thing which is very, very, very important. So if you have to choose somebody you have to learn from. See, first of all, talking about learning. If I make up my mind to learn something,
Yes.
so the first thing that should be that I have to learn this skill.
Very true.
So what happens normally is people make a mind, you know, I want to learn this. And you know, this is a human tendency that you will sort of, you'll make your mind and you'll start looking at sort of, you know, comparing the prices bang on, right away. Yes? And then you will choose, if you choose the cheapest, for example, you will realize that, you know, you sort of wasted those days. You did not get what you expected.
Yes.
Okay? You're not sort of ready to do these procedures. You've never heard of many things which I've sort of spoken about today. A lot of people don't know that they are injectors, you know.
Absolutely.
So these are important things. You cannot work on a dummy model and then straight away go on a patient and do it. This has to be done monitored, and this is done exactly same way in all the fields. In organ transplant surgeries and, you know, sort of all sort of surgeries, people train under someone who's doing it,
Yes.
and then they gain experience. You will never be born with experience. You have to have your experience.
Yes.
You know, experience is something that doesn't come. You cannot buy it. Okay, you have to earn it. You have to sort of, you know. So these are few important things, important ethical issues about training. You know, and holding the hand of people who've trained from you, because it's not just that, you know, we just do a workshop and, you know,
And you just
it's over.
leave them.
No, you have to be that. See, when I started, very few people were doing these procedures. So I had to, you know, sort of, it was very difficult for me. I had nobody to sort of, you know,
No
ask so
support
many
and,
questions,
yes,
you know, that comes
guide you.
yes, to guide me, and, you know, I've learned it the sort of hard way,
Yes.
you know. So what my workshops have is my experience, my mistakes. You know, mistakes
Yes.
are a very big part of learning. You know?
That's how you learn.
Yes,
You never learn
yes.
without making mistakes.
Yes, this is what experience is. You know, someone who's learned something. See, it is very easy to teach. You know, I talk about sort of Botox, and, you know, it's theoretical. You can talk about
Yes.
it. You can do a little bit here and there. What if first of all, an experienced person will tell you, okay, listen, this is a conventional way to do it, but don't do like this. This might lead to some complications.
Yes.
Okay? So there the experience comes in.
True.
Then I have a very structured program. I know what to teach, how to teach,
Okay.
so that when I finish my teaching, you know, people are ready to work. Then I have to guide them. everybody needs guidance. So I'm always there. We have support groups. We are constantly discussing also. I'm also learning from them.
Yes.
Of course, everybody's learning. We are colleagues. We are not. I'm not like a teacher.
Lifetime process.
Yes. There are certain things which I learn from them. There are things which they learn from me, and this is how it is. So it is very, very important that when you make up your mind that you want to learn something, the first step, do not think how much I will learn out of it. I want a job out of it. No. This is all second. When you make up your mind, just focus on learning a skill, the right skill, And then I normally tell all the people who are interested that please check my profile. Please don't hesitate asking me what work I do. Have I done these cases? What I'm teaching you?
Yes.
Do I have that experience? This is important. You have to do a back check. Online.
You have to
online
see
it's very easy these days. You make a brochure, put it up. Nobody knows you.
Exactly,
They come
yes.
across this year. Sort of price difference, and so you have to do a background check. How many years they're practicing? I would never teach something where I don't have experience of at least 5 years. Because you do follow-ups and all that
Yes.
stuff. At least, depending on what skill level a certain thing is. I would first do my work, analyze, sort of get people back, see all these things. Have that kind of an experience. It is very, very, very important. If you learn from an inexperienced person, you're just, sort of doing the contradictory. You made a plan and, you sort of.
And I think maybe from what you say, the USP of what you do is that you give practical experience to the people
This is
who
the
come
most
for
important.
training.
Practical experience, yes,
workshops.
is the most important experience. Hands-on experience, real hands-on experience, under guidance. Yes.
And also, if we take the patient's perspective,
Yes.
so anybody, like even for example, let's take me. If
Yes.
I also have to come for for any kind of treatment, or I want something to be done with my face.
Yes.
So I would definitely want to see how authentic is the person.
Yes. How much experience they have.
Yeah,
This
how
is a
much
natural.
experience
Any
the
one
person
of us.
has.
Any one of us.
And,
Even if we are doctors or non-doctors, we would like to be treated by someone who we see has good experience in.
Yes.
I
mean, we wouldn't even care much about the degrees the person is holding.
Yes,
We
yes.
would be more interested in the actual
Yes.
thing,
Exactly.
the dexterity that the person has.
Of course,
I
yes,
guess.
yes.
So,
This is what I want to tell all my sort of students, my potential students, colleagues, and also the patients. The bitterness of cheap stays for a much longer time after the sweetness of cheap price is forgotten.
well said.
Yes. So this is very important. Yes.
That's very true. No, honestly, Dr. Rajat, whatever queries I had and the way you've answered these questions, I think it's actually an eye-opener, not only for the doctors, but even for people who are right now just sitting in their houses with these conflicts in their minds, as to if they want to get something done, can they go for it when it comes to budget or when it comes to reactions or side effects.
Yeah.
And I'm sure that you actually are doing a wonderful job, because the kind of security your experience and knowledge provides, that actually is a lot of support when we come to the psychological aspect also.
This is very important, the psychological mindset. See, what happens is, we do all sorts of things to feel confident. This is our human basic nature. We buy nice clothes, we buy sort of nice jewelry,
Yes.
nice watches, nice. We want to look the best version of ourselves.
Yes.
And when we are talking about injection, it is not just about anti-aging. There are people who have sort of slight, for example, they'll have a slightly smaller chin, and that's sort of preventing them to look their best.
Yes.
And they have this thing inside. They are not feeling sort of confident about themselves. Yes. So these little things, they have a huge psychological impact. And I've seen people, being introverts.
Yes.
After getting their treatments done, they are so extrovert, they're so confident, so there is a big psychological
Aspect.
aspect to it. And what better can you do? If you help someone have that kind of confidence to go out there and do what they have to do.
Yes, that's just amazing, and that's very good. And I wish you all the best. And I would like to tell everybody who's watching this video that now you have this person, Dr. Rajat Bhandari, who's doing an amazing job in his field, and without any inhibitions, everybody can come and speak to him whatever queries they have,
Exactly.
and they can actually have a beautiful face and a beautiful life.
Yes.
Thank you so much,
Thank you so much,
It was a
Sakshi,
pleasure.
for inviting me for this session, and I hope you'll be able to write. Your write-up will be better now after this discussion.
Definitely. Thank you so much.
Thank you so much. Thank you.